The following segment is sponsored by Oakview Medical Associates.
COVID-19 testing continues to top the headlines, but what do you need to know about the testing process and questions you could ask, and what happens if you are diagnosed? Dr. Nita Bajor of Oakview Medical Associates is here to help us sort it out. Good morning, Dr. Nita.
Good morning. How are you, Margaret?
Great, great. Good to see you. First, let's talk about the symptoms. I know there's a poster at Oakview Medical Associates that said if you have these symptoms, please see the front desk immediately. What do we need to know?
So the common symptoms we're seeing have always been the fever, cough, and shortness of breath. But now we also have patients presenting with fatigue, muscle aches, body aches. And then I just go symptom-wise. So headache, nasal congestion, sore throat, cough, like I mentioned, nausea, vomiting, diarrhea. And another one is loss of taste or smell. So just being mindful about your symptoms and contacting your physician early on in your symptom presentation so we can help you. That's important.
All right. What kind of testing is available at Oakview Medical, and what's the process like?
So the process varies. If you have symptoms, when you call ahead, we'll check you in over the phone, and then we'll have you park in our parking lot, check in curbside, we call that. And then a provider, once you're checked in, a provider will call you on your phone and go over your symptoms, just like pretty much like an office visit. That can also be done as a tele-visit through the person's phone in the car. Once that's completed, we will decide if we need to do just the SARS testing or if we need to do any other testing. We're seeing strep throat, we're seeing a lot of other things too. So we have the ability to swab for strep, other tests as well. And then one of us will come to the car, complete the visit. Once that's done, we will then discuss with you what we need you to do. Most likely, if we suspect COVID-19, we will have you stay home, quarantine, or isolate. So there's two different terms I want to explain to our viewers on what that means. Also, supportive care. Right now, resting is the big thing, getting enough sleep, getting enough hydration. So we'll go over those things with the patient at the appointment.
Okay, and before we get into that, we get the results, maybe the turnaround could be 4 to 6 days at this point. What do we need to keep in mind? What do those results actually mean?
So there are essentially two types of tests. One is the test to check for the antibody. That really doesn't tell you if you are actively, if you have the SARS virus. All it does is it tells you you might have been exposed. However, we're seeing negative antibody testing in patients, and they still may pick up the infection. The other one is to look for the actual COVID-19 infection, which is through SARS-CoV-2 nasal swab testing that looks for the actual antigen. And that's the one that, we used to have a turnaround of 1 or 2 days. The national labs now have a larger turnaround time of maybe 6 or 7 days. So that doesn't mean you're in the clear. While the test is still pending, we want to treat you as if you were positive if you have symptoms, and still practice all the safe precautions and take care. So those are the two main tests that are available.
Okay, now if you're waiting on those test results, or if you've tested positive, let's talk about the next steps there. Who quarantines? Who isolates? What's the difference?
So the CDC, has a wealth of information, and they have a very nice infographic for patients to look up. Quarantine means that somebody who has been exposed to a close contact of somebody that tested positive or seems like they have COVID symptoms tends to stay away from others and takes care of themselves, rests in their home, still practices social distancing. That's quarantining. But isolation is when a patient that has the symptoms or has tested positive and doesn't have symptoms is still treated with a little more care, isolating, staying in a separate bedroom space if possible, not sharing utensils, minimizing interaction, especially with the higher risk elderly in your home. And that has a different set of guidelines. We want patients that are presumed positive or have symptoms or have tested but without symptoms to really stay at home for at least 10 to 14 days. Your provider will explain that to you. Also, to make sure that they stay isolated until they're symptom-free for at least 3 days. So that's important.
Well, and you're saying there, somebody sick, living with other people should have a separate room, a separate bathroom, especially if possible. Anything else you want people to know before we let you go today?
Another very important thing is right now we don't have all the information on COVID-19 and SARS. There's a lot of research, a lot of data coming in. It's the smartest thing to really take care, take the highest precautions, to use all the measures in place, because that's the way our communities will stay healthy. Just to give you an example, in the hospitals, our physicians are admitting a lot of patients. The patient might have been admitted for just a hip replacement, knee replacement, was about to go home, but a family member visited, and the family member was in contact with somebody else that tested positive. Well, the family member may not be sick enough and has unfortunately transmitted that to the patient that was about to be discharged. Now the patient has the COVID-19 and is admitted and in the ICU. So we impact one another more than we know. And this is a time for us to really practice safety guidelines so we don't get our family members sick. That's an important message I want to send across.
Absolutely. So stay safe. Thank you so much, Dr. Nita. Oakview Medical Associates is located at 11 Five Works Plaza Court in Simpsonville. The number 627-0444 on your screen. Have a great rest of your day. We'll look forward to talking to you again soon.
Thank you. You too.